are the differences between day shift and night shift. In this video, I will be sharing with you guys the pros and cons to both nursing shifts because there are quite a few. And I've actually worked both shifts in the past, both day shift and night shift. So I do have experience working those two shifts. So first off, I do want to start off with telling you that there is a big difference on the pace that you experience during both shifts. Now, with that being said, that doesn't mean that one shift is busier than the other. Nope, because they're both busy. So you'd be surprised, you know, you'd think that because people are sleeping during the night, or maybe they're not, because sometimes they don't, that it might be slower, but that's technically not true. You're still busy on both day shift and night shift. And I'm gonna explain to you why the pace during day shift is a lot faster. And that is because there are more procedures. So that means there's more imaging procedures, there's more surgical procedures. And that also means that you're coordinating a lot more care during the day shift with speech therapists, pathologist, radiologist. You are just doing a lot. And not only are you doing that coordination of care, but you're also rounding with doctors, and you're just multitasking a lot, because while you're doing all that, in between all that, you are calling the doctor. Like if they're actually not on site, you have to call them and talk to them and explain to them what's going on with the patient and what orders you need for the patient. So yeah, it's just a lot faster. Oh, and not only are you providing care to the patients, but also to the family members and the visitors that are coming to see your patient. And that means that you're most likely answering a lot of the questions of the family members, because they're going to have a lot of questions for you during the day shift, because that's when they are allowed to come in to visit. So that's a huge difference. Now, it's probably different now because of the pandemic. Maybe there's not as many visitors. But now that I think about it, that probably means that there's more family members that are calling you to ask you about their family members. So I guess it doesn't matter. You're still busy either way. But I also want to mention that there's a lot of admissions and discharges during day shift. There's also admissions during the night shift, but the discharges are very minimal unless you work in an ER. Then of course you're gonna have, you know, discharges during the night as well if you're the ER. But if you're inpatient, then they most likely occur during day shift. So of course the night shift is a lot slower. The pace is slower, but still busy, because there's no doctors, there's no family members, you're not coordinating care. I mean, every once in a while there is a time where you have to have a certain procedure done after 7 o'clock, like 7 p.m. and you do have to coordinate that with the radiologist, etc. But it's very rare during night shift, unless, once again, you work in the ER, then that is absolutely, you know, totally different. And of course during night shift there is no management there, so they're not constantly watching you. I mean, yes, the charge nurses are there, but you know, they have their own work to do as well, so not as much management is walking around, or educators walking around during night shift. Which means also that during night shift you have less resources, because you don't have as many people there like you would if you were during the day. And like I just mentioned, because there are less resources to help you during the night shift, that also means that you have less of a help from the nurse's aide. And that is because during night shift, the nurse's aides have a lot more of a patient load than you would during AM or PM. So there are more like nurse's aides during the day shift and the PM shift than there are during the night shift. So that can get a little tough, but that is why I always preach that it's so important that you have a good relationship, well, with everybody, but especially with the nurse's aide, because they're going to be the ones helping you out. So make sure to always have a really good relationship with them, and with everybody, of course, but especially with them, because you're working super duper close with them, and they're the ones that are going to be helping you turn the patient, etc. And if you have a really bad relationship with your nurse's aide, that could ruin your shift. So I'm telling you now, be nice to your nurse's aides, be nice to the CNAs, or I think some people call them PCTs. Be nice to them because they will save you. And another con to working night shift is the transition from night shift to day shift on your days off. It sucks, you guys. So let me tell you what I would do. I would go into work at 7 p.m. I would come out at 7:30 a.m. and that would be my last shift. So I would be off for, let's say, 3 days. So that means that I would stay up all day. So I would be up for over 24 hours so that I could sleep at night, so that I could have a actual day off for the next 2 days. Because the first day, you're really just recuperating from night shift. Either you're sleeping or you're just like feeling super groggy because you're awake all night. So that means that on your first day off, you really don't have a lot of energy to do a lot of things. And although sometimes I would still go out during the morning after work, I would feel like a zombie. So I will be making a video in which I share what shift I think is best for new grad nurses. So that video will be coming very soon. So I hope that you guys enjoyed this video. Make sure to like this video, ring the bell for notifications, subscribe, and I'll see you on the next one.